Hello today. This is Irish 17, Phoenix Rising 97, however you guys want to call me. Irish Pepper, I think is what it's listed under. Still new to this, so still getting the hang of it down, getting these videos out. Today, I want to talk about the top 10 drugs, obviously, to Stockpile. You see that right there on the chalkboard. Basically, these drugs, these are the over-the-counter drugs that you really need to decide if they're worth stockpiling or not. And I can guarantee you that almost any family physician is going to answer that question with a resounding yes. Okay, most of the following were actually prescription medications when first released in higher dosages. Several still are. Okay. Although other OTC drugs are worth considering, these 10 have been selected by, in this book that I've been reading, 101 Ways to Save Money on Healthcare. Okay, these seem to be the ones that are kind of up front. They're ready for you to select as the ones that you would most likely put in your emergency preparedness kits or your stockpile anyway. So, anyways, these medications are affordable. Most of them are really safe for both adults and children, and they have multiple use. Most of them have multiple uses, not just exactly you know what I mean. Anyways, moving on. So most of these you can use alone or in combination. They can effectively treat dozens of conditions, including headache, fever, sore throats, earache. For your women out there, menstrual cramps, okay, heartburn, arthritis, ulcers, diarrhea, allergies, hives, congestion, dizziness, mild anxiety, nausea, vomiting, poison ivy, athlete's foot, ringworm, eczema, insomnia, back aches, gout, diaper rash, yeast infections, and tons of other stuff. So, first one up there, ibuprofen, most commonly sold as Motrin or Advil, and obviously you get the cheap stuff if you can. If you're stockpiling this stuff, you get the cheapest stuff you can. Don't go spending a lot of money on this. It's one of the keys to prepping is conserve your money. Okay, spend it wisely. If you're religious out there, those of you that are out there that are religious, if you guys are paying tithing to your church, that's 10%. God is trusting you with the other 90%, and so and He's only asking for that 10% back. So there's a big responsibility there to actually to use the money that He has let you acquire, to use it wisely. So anyways, as far as ibuprofen goes, anti-inflammatory medications like this are probably the most versatile. You can use them with tons of stuff. Primarily indicated for pain and inflammation, but it also may be used to relieve headaches or earaches, sore throats, sinus pain, stiff neck type stuff where you just been straining too much, focusing on things. Good for you, for us out there that are going to be pulling duty in one position, maybe guard tower duty or something like that. If you're a militiaman out there. So anyways, for women, it can be used for menstrual cramps. You guys know this. This is a pretty broadly used OTC drug. So when you combine this with Tylenol, acetaminophen, which is the next on the list, it's actually almost as effective as codeine. I mean, this stuff you do this right, and you just do a little bit of research on these things, and you're going to be able to find out that codeine or tramadol, hydrocodone, okay, those two things together treat very severe pain most of the time, okay. Now, so moving on to Tylenol, acetaminophen, okay, It's the only over-the-counter pain reliever that is not an anti-inflammatory drug. It will not irritate the stomach like ibuprofen, aspirin, or naproxen. Okay, or naproxen. I say naproxen, but I know lots of people recognize that as naproxen. But it is useful for the same conditions as ibuprofen, though its effectiveness varies according to the patient. Okay, so there's a lot wider range according to who's using it. So the side effects are very few. Though, I'm sure lots of people are aware it's like 300,000 people die of Tylenol. I don't know if that's exactly true or exactly right, but there's a lot of people that actually die from taking Tylenol. But most of those people are taking it in large quantities with alcohol and it leads to liver failure. Okay, so there's some other things that go along with dying from Tylenol, not just you pop a couple pills and you died. So anyways, next one, Benadryl or diphenhydramine. Okay, and it's inexpensive. It's an inexpensive antihistamine. It's primarily used for drainage for your respiratory infections, nasal allergies, and stuff like that, both adults and children. But it's also indicated for hives and itching, allergy type stuff, even poison ivy. Okay, not all patients become drowsy with this, but many do, and so it's also useful for insomnia, getting to sleep and stuff like that. And some people even find it useful as to treat nausea or like mild anxiety. It'll calm you down. Okay. Fourth one. Okay, loperamide, Imodium. Okay, most effective for diarrhea when you just can't stop running to the bathroom every 3 seconds and your butt starting to hurt. Excuse my language. Being rubbed raw. You wanna plug that up quick if you can, for adults and children. I mean, you just don't want to be in pain, especially when there's not a lot you can do and you're just sitting alone, let's say in a basement, hiding out. Okay, let's say that's the situation. You don't want to be crapping everywhere. Okay. So anyways, it can release intestinal cramping as well. Okay. Pseudoephedrine or Sudafed. It's good for congestion of the upper and lower respiratory tract. Okay, going to get a lot of that crap out of there, help you cough it out. It can also be used for like chemical irritations in the throat, leading into the lungs, mild asthma, or even bronchitis. Okay, frequently has a stimulatory effect. Okay, it's going to wake you up. It's kind of like caffeine. All right, you'll feel like rapid heart rate, increased blood pressure. Maybe your heart's skipping a couple beats. Palpitations is what people call them. Years ago, this drug was even used in young kids, even babies, but most pediatricians don't advise it for patients younger than like 6 years old. Okay, moving on to number 6, meclizine, sometimes known as bonine or Dramamine. Okay, this is great for vertigo, motion sickness, things like that. But for lots of people, it will also cause drowsiness, and therefore it's also useful as a sleep aid. Okay, there's a dual purpose there. It's also those chemical makeups are related to of these two types of drugs, bonine and Dramamine. They're related to the same things that are used for treating anxiety. So it might help with that as well. Ranitidine or Zantac. Although several medications are available over the counter for treatment of heartburn, ulcers, and other acid reducing conditions, ranitidine is among the best tolerated. It's inexpensive, and it is also used for relieving hives. Okay, so doctors often advise an acid reducing medication such as ranitidine for patients who experience stomach upsets when taking ibuprofen. So if you're taking the ibuprofen but you start to get nauseous, okay, or you're having like acid reflux, from taking that or something like that, take some ranitidine. It's hard to say this. Zantac. I'm just gonna say Zantac. Take some Zantac. It could be the thing that causes that to calm down. Okay. Number 8, Hydrocortisone Cream. The 1% version of hydrocortisone is usually the strongest that you can find. It's a steroid cream. that's available over the counter. Okay, it's safe for both use in both adults and children in treating inflamed and or itchy rashes such as eczema, poison ivy, diaper rash. Okay, and other genital irritations. Okay, all right. So that's could be a really useful one to have. All right. I know I'm a massage therapist, okay, as my day job, and these type of creams, I'm not really allergic to anything. I have my little hay fever allergies and stuff in the spring and stuff like that, but this cream, the lotion I use, almost any one that I use for the work that I do, I get a little bit of rash every once in a while from using so much lotion or so much massage cream. And this is what I use, and it calms it down really quickly, okay? So, I mean, when you're just sitting there itching, it's kind of like a mosquito bite. That's what it feels like. Get a couple mosquito bites, and it just won't go away. There you go, hydrocortisone. Okay, next one, bacitracin. This ointment, it's basically best used to prevent like skin infections when the integrity of the skin has been compromised. Okay, it's been breached, like scrapes, abrasions, lacerations, insect bites or stings. Okay, it may also be used to treat a like superficial skin infection such as mildly infected wound or impetigo. Okay, it is less likely to produce a topical skin allergy than some other topical antibiotic preparations. Some of them that contain like neomycin. Okay, but it can't be used to treat like deeper infections. Okay, so if it's a cut, you're not using bacitracin. Okay, you're going to be taking a pill, some kind of we call it like antibiotic. Sorry to blank out there for a second, but you're going to have to take an antibiotic by mouth. Okay, for the deeper stuff, just to keep yourself from getting your wound. If it's a big cut or something like that, you've been hooked on barbed wire or something like that, you don't want to be getting infected. Okay, so you're gonna bandage yourself up and you're gonna pop a pill and an antibiotic by mouth. So, but leading us into number 10, clotrimazole or gyne-lotrimin. Okay, these are like Lotrimin or gyne-lotrimin. These are antifungal medications. The clotrimazole is contained in both Lotrimin, like Lotrimin AD, and these sports like foot, athlete's foot, and jock itch and stuff like that. It's in both of those. Okay, Lotrimin or gyne-lotrimin. Gyne-lotrimin may be used for both female yeast infections and any other yeast or fungal infection that Lotrimin would treat. Okay, like I said, athlete's foot, jock itch, but also ringworm, diaper rashes, and skin fold irritations. For those of you that are more on the skin folding size of a human being, don't take any offense to that. We're all going to start off pretty chubby, or lots of us will start off pretty chubby. When Teotihuacan happens, or the SHTF situation starts to go down, but very quickly we're all going to be in very good shape, as long as we're not being the lazy guy, benefiting off of everybody else's hard work. Okay, but all of this stuff can be, with a $50 investment, you can get a really good supply of all of this stuff. Okay. Most of these medications can also be used at higher doses by prescription and may actually be less expensive if you get them from a prescription by a physician. Even paying full price. So, but all of this stuff has been discussed in this book that I talked about at the beginning, called 101 Ways to Save Money on Healthcare. Okay, so I would definitely go check out that book. But you can find it online for like $10 or less and stuff like that. But it talks about a bunch of stuff. Carpal tunnel, warts, mental illness, asthma, COPD, depression, diabetes, all that stuff. So go and check it out, okay? Take care. This is Irish Prepper signing out.